Okay, so we are going to talk about the Tenet Healthcare Corporation 2020 financial performance and its annual report. So Tenet Healthcare is a for-profit healthcare organization, and it has an extensive amount of shareholders throughout the US. And this project is really focused on examining the financial performance for the 2020 fiscal year, as well as the organization's expansion efforts and business strategy through the COVID pandemic. And then we'll kind of be able to talk about we'll be able to do an analysis and talk about its strengths and opportunities to provide an outlook for the coming years for the organization.
So they are headquartered in Dallas, Texas, and they provide healthcare services through their network of over 65 hospitals and 500 additional healthcare facilities. These facilities include surgical centers, urgent cares, imaging centers, etc. And they also provide revenue cycle management and value-based care services through their subsidiary, Conifer Holdings. For business purposes, they are reported as three separate lines. They are hospital operations and other, ambulatory care, and Conifer. And the CEO is Ronald Rittenmeyer. His background, he has an MBA from Rockhurst University. He served on actually like many boards of different businesses. He was awarded an honorary doctorate of humane letters from Wilkes University, and he has tons of experience. I'm only putting a little bit of it on here. He was the managing director of the Cypress Group. He was chairman, president, and CEO of Electronic Data Systems. He was the chairman and CEO of Millennium Health, and also successfully led them out of bankruptcy. And then here are just the board members. I'm not going to list them all, but they are all listed here. And then the directors.
So the Tenet Healthcare Corporation has three main divisions, the first of which is Tenet Hospital Operations, which operates 60 acute care and specialty hospitals in addition to primary and specialty care clinics, diagnostic imaging centers, micro-hospitals, and standalone emergency departments spread across 9 states. Their second division is the United Surgical Partners International, which includes ambulatory surgery centers and surgical hospitals that comprise the largest ambulatory platform in the country. They're partnered with over 50 not-for-profit health systems and thousands of physicians. Lastly is Conifer Health Solutions, which provides healthcare-focused revenue cycle management and value-based care services to 660 clients across the country. They manage $25 billion in net patient revenue annually and support care management for 5.9 billion patients. Their clients include hospitals and health systems, physician groups, health plans, and self-insured organizations.
Their mission statement is to provide quality, compassionate care in the communities we serve. Creating an ethos of good health, wellness, and responsibility is central to our mission and an everyday commitment to our neighbors and families.
All right, so Tenet Healthcare is actively expanding their company, and they are not only doing this by acquiring more facilities, but also by investing money into hospital operations such as ambulatory surgery centers. And their responsibility primarily lies in providing quality, safe healthcare to their community, but they also pride themselves in aiming to provide a good work environment for their employees. And lastly, they try to implement sustainable practices to benefit their community as well.
Like we stated earlier, they are located in Dallas, Texas.
A key business strategy for USPI in particular is to the acquisition and development of new facilities through formation of joint ventures with physicians and healthcare systems. And Tenet earns revenues for patient services from a variety of sources, primarily managed care payers and federal Medicare programs, as well as state Medicaid programs, indemnity-based health insurance companies, and uninsured patients. And the following table shows the sources of net patient service revenues, less implicit price concessions and provision for doubtful accounts for our hospitals and related outpatient facilities expressed as percentages of net patient service revenues, less implicit price concessions, and provision for doubtful accounts from all sources. The business is subject to many risks and uncertainties, which can have had adverse effects on the business, financial conditions, operational conditions, liquidity, and the trading price of the stock could decline, and also the stakeholders could lose all or part of their investment. As you can see, there's many risks. Some include impact from modification of the Affordable Care Act, further changes in Medicare and Medicaid programs, breach or failure to comply with the new non-prosecution agreement, inability to enter into new managed care contractual agreements, cost reduction initiatives that do not deliver the benefits expected, competitive environments can affect the patient volume, and national or localized outbreak of a highly contagious disease and a pandemic outside of the United States.
So this is information from the consolidated statements. Their net income loss was $466 billion. Total assets were just under 22.5 billion. Liabilities and stockholders' equity was also just under 22.5 billion. Net cash from operating activities was 1,049 million. Investing activities were a loss at 115 million. Their financing activities were also at a loss of 1,134 million. Their charity care was 124,000, and their total diluted earnings was $1.04 per share. Their acquisitions and divestitures, so they actually had quite a bit, but I'm just going to touch on the ones from 2019. So they acquired 10 outpatient businesses and also multiple physician practices, and together the purchase price was about $25 million. And they unloaded 3 Chicago area hospitals with affiliated operations at a loss of $14 million.
So Tenet Healthcare Corporation stock is traded under the New York Stock Exchange under the stock symbol THC. And the interesting thing about it is it doesn't actually, they don't pay their shareholders stock dividends. Instead, they reinvest its profits back into the organization because they feel that this will be more beneficial financially for its shareholders. And then this is all of their stock information for the 52-week period.
For our SWOT analysis, some of the strengths were good returns on capital expenditure. Tenet Healthcare Corp is relatively successful at execution of new projects and generated good returns on capital expenditure by building new revenue systems. A weakness would be limited success outside core business. Even though Tenet Healthcare Corp is one of the leading organizations, it is in industry, it has faced challenges in moving to other product segments with its present culture. An opportunity would be the new taxation policy can significantly impact the way of doing business and can open new opportunity for established players such as Tenet Healthcare Corporation to increase its profitability. And a threat could be new technologies developed by the competitor or market disruptor could be a serious threat to the industry in the medium to long-term future. And outlook for the company, Tenet Healthcare withdrew their 2020 outlook due to furloughs of COVID-19 uncertainty. Tenet Healthcare first released their 2020 outlook as part of its fourth quarter and year-end earnings report. Officials projected they would earn between 130 million and 245 million over the course of the year on revenues, released 19.1 billion. They expected to defer elective care. Tenet officials said they were looking at beginning elective procedures starting in early May, a projection that is subject to change based on how things play out. Tenet's chief operating officer said their liquidity, when it came to liquidity, the Dallas-based hospital said it has about 350 million of excess cash and cash equivalents and approximately 100 billion of borrowing availability under its senior secured revolving credit facility. And Tenet officials are also seeking an amendment to its senior secured revolving credit facility, which will include increasing total borrowing capacity under the facility to 2 billion up to 1.5 billion. And these are two ending reports that I found from the 2020 outlook. A lot of the information was not given considering they withdrew their outlook due to COVID, but these were some of the numbers that we found.
So in conclusion, Tenet Healthcare is a uniquely positioned healthcare services company with a high growth, high margin ambulatory surgery division. They've continued to prepare Conifer for a tax-free spinoff. Their actions in 2020 helped Tenet Healthcare Corporation to prepare for the spinoff by restructuring their short-term contracts to limit the scope of services provided. In 2020, they built upon United Surgical Partners network by adding 3,700 new physicians to their medical staff. In addition, 61 new surgical facilities were completed and 73 new service lines were added, including orthopedics, spine, robotics, and bariatrics. And they've taken actions to improve their financial standing by improving their cash collection process. $1.3 billion of notes were issued to enhance liquidity. Their line of credit was increased $400 million, and roughly $2.5 billion in debt was restructured to provide $50 million of interest expense savings. And additionally, they limited all